In order to create the Smile Preview-Veneer, you first open the blister pack of the Proveneer resin foundation material and take a small amount, place it in between your thumb and index finger and roll it into a ball and compress it. Next, place it beginning on the incisal edge of the tooth to create a stop and work it down halfway down the incisal to the middle of the tooth. Doing that with your pinky finger. Your glove should be very snugly fitting so that there are no creases in the material as you're working it onto the tooth. Next, you can take the material and continue to tease it onto the facial surface down toward the gingival. You should always start with the smallest amount of material so that you don't have a bulk of excess at the gingival. This will minimize your finishing time. Once you get the material on the tooth, you can then do some shaping with a plastic instrument or your pinky finger to get the characterizations that you want. Once you are satisfied with the appearance of it, you light cure the veneer in 5 different areas: incisal, facial, gingival, mesial, and distal. At this time, you will then show the patient how the Smile Preview-Veneer looks. Once they see how it looks, 95% of the time, they want to move forward with the procedure. So the next phase is to remove the veneer off of the tooth. This is done gently by getting an instrument under the edge of the veneer and prying it gently from the tooth. It should come off in one piece and appear as a veneer. One caveat is to make sure you do not bring the material over onto the lingual surface, because this will lock it onto the tooth and you will not be able to remove it. It will fracture. Once we have the preview veneer off of the tooth, we're then going to process it. We use a cup of water placed in a microwave for 3 minutes. This puts heat on the veneer to increase its physical properties and make it more resistant to staining. Dry the veneer and place etchant on the inner surface of the Proveneer for 30 to 60 seconds. An option is to micro-etch the inside of the veneer, but this should be done for only a second or less, as the veneer is very thin and this could cause the veneer to fracture if not done very carefully. Once the veneer is etched, flush it off with copious water to remove the etchant. Dry the inner surface of the Proveneer and apply a thin layer of Proveneer bonding agent. Do not cure the bonding agent. Apply a thin layer of cement using Profil Flow Cement, using the same shade as the Proveneer, which is included in your kit. Next, apply etchant to the tooth for 15 to 60 seconds and rinse with copious amounts of water. Apply an ample amount of Proveneer bonding agent, leaving undisturbed for 15 seconds. Gently blow off the excess with an air syringe so only a thin layer of bonding agent remains on the tooth. Place the Proveneer filled with Profil Flow Cement on the tooth and very, very gently press the veneer on the tooth with pinky pressure. Be very gentle when putting the veneer on the tooth or it will fracture. Remove any excess cement and then light cure in 5 areas: incisal, facial, mesial, distal, and middle of the tooth. Once the veneer is light cured, contacts can be checked. If the contacts have inadvertently been bonded to the adjacent tooth, you may use a separating strip to open the contact, and then finishing strips to polish the proximal surfaces. Check to assure with an Explorer that you have a seamless emergence profile. This is important for the maintenance of the gingival health. You may use light polishing with a finishing diamond or carbide finishing burr to ensure a ledge-free emergence profile. Take your final after photographs Show the patient the transformation that has been achieved.
Wow. I love it. It's so straight and it's just so perfect.
So we've found that Proveneers work great in our practice because our patients really prefer cosmetic dentistry where they can do it non-invasively, where they don't have to have their teeth prepared, where it's more affordable for them. So a lot more patients are choosing this method. So we're not selling cosmetic dentistry to our patients. We're informing them of the process, and we're educating them about it, and then we're motivating them by showing them the Smile Preview-Veneer. And probably about 90% of the time, when they see the Smile Preview-Veneer, they don't want to have it removed. They want to have it completed. So we've been able to start about 30 or 40 veneers a month by using the system from the Silverman Institute.